So that's how we can tie all three together. And so if you're thinking in those terms as a practitioner, it's very useful to try to analyze it that way and decide which effect you want to use. It's very other things that come out of this is which is the best frequency to choose. And it's clear that if you want to get into the serotonin system via number 15, it would be a good idea to stimulate at 200 per second. But if you want to get through the local segments and through the pituitary, then 4 per second is good. So I would suggest that some points you treat at 4 per second and others at 200 to cover both possibilities. And finally, I see down the road people giving chemicals to enhance the acupuncture effect, to get a real ideal treatment. I should point out that the many millions of dollars have been spent on trying to find better and better endorphins. In fact, there's one endorphin molecule which is now 20,000 times more powerful than morphine. And you might say, well, if that's the case, then why bother with acupuncture? Well, it turns out that these chemicals are also 20,000 times more addictive than morphine. If you give a chemical by injection, by an artificial means like that, the body reacts by becoming tolerant to it and also becoming addicted to it. But although this is a bit controversial, the evidence to date is that acupuncture is not addictive. And the reason we think that's true is the following. That when you inject endorphin, say, into the bloodstream, what it does is it, say, comes to the pituitary and causes suppression of pituitary function. It inhibits it by negative feedback. The body says, well, I've got plenty of endorphin, why do I have to make my own? So it becomes very sluggish and it sort of goes to sleep. The pituitary gland just goes to sleep. So if you suddenly stop giving endorphin or morphine or heroin or any of those, the person suddenly goes into withdrawal because his own system is suppressed and you're not giving him any more heroin, so he's very ill. But if you work through the endorphin, that is, you needle the person and keep the pituitary active, or keep this number 11 active, or keep number 9 active, and say you give drugs that block the enzymes, you're not causing any of this negative feedback because the system itself is toned up. You're toning up those cells, keeping the endorphins flowing. And so if you suddenly stop needling these people, they don't develop addiction, they don't develop tolerance. And in fact, that's what it looks like. In fact, one of the exciting things, forget about acupuncture, the most central question now in pain therapy with drugs is to try to get around the addiction by just giving the enzymes alone. Unfortunately, they're not as powerful as combining them with acupuncture. So I think that down the road, people will realize that if you can combine the two, combine acupuncture plus these enzymes, you'll have a non-addictive, and that's the important point I want to make. The enzymes, I should stress, when the enzymes are given, they do cause pain relief, but they are not addictive, and also they are very safe. You can give 100,000 times the clinical effective dose of these enzymes, and they don't cause any toxic side effects. So it looks like this may be the way to go for pain treatment, just giving the enzymes, but I say that combining the enzymes with acupuncture is the most logical, because if you just give the enzymes alone, we know that number 9 and number 11 and 17 are not tonically active. That is, in the normal awake person, there isn't much endorphin release. So that if you could release the endorphins through acupuncture and then protect them from destruction by giving the anti-enzymes, you have a very powerful combination. So.